Welcome back to another episode of HealthCap Weekly Wrap. If it feels like the senior living industry is being hit with challenge after challenge, you're not imagining things. This week, we're talking about the financial pressures shaking up the healthcare sector, new research on osteoporosis that reinforces the importance of fall prevention, and a fascinating study that suggests speech patterns could be an early warning sign for dementia.
Yeah, there's a lot to cover today. Let's start with the financial side of things, because when senior living communities are struggling to stay open, it affects everything from staffing to resident care. A new report from Gibbons Advisors found that healthcare bankruptcies hit their second highest level in 6 years in 2024. And no surprise, post pandemic recovery hasn't exactly been smooth sailing.
Right, and what's driving these bankruptcies is a mix of factors: higher labor costs, reimbursement struggles, and the long-term effects of the pandemic. The report shows that a lot of smaller and regional providers are especially vulnerable since they don't have the financial cushion that big hospital systems do. When these smaller providers shut down, it leaves residents and families with fewer care options.
And we're already seeing the impact. Communities are cutting services, struggling to meet staffing requirements, and in some cases, just closing their doors. This isn't just a number on a financial report. Real people are affected, and it's putting even more pressure on an already overburdened workforce.
Exactly. And let's not forget about the regulatory side of things. With new staffing mandates and insurance costs rising, it's becoming harder for senior living communities to operate sustainably. So the big question is, what can providers do to stay ahead of this?
Well, financial resilience has never been more important. Communities need to take a hard look at their risk management strategies, find ways to optimize reimbursement, and, honestly, keep advocating for policies that support long term sustainability. Because if these trends continue, we could be looking at even more closures in the near future.
That's a tough reality, but an important one to keep in mind. Coming up next, we're shifting gears to a major health concern for older adults: osteoporosis. A new study reveals just how deadly hip fractures can be, especially for residents with underlying conditions.
Yeah, this study by MedPage Today is putting a spotlight on just how dangerous fractures can be for older adults, and the numbers are alarming.
They really are. The study found that hip fractures aren't just a mobility issue, they can be life-threatening. Older adults who experience a hip fracture have a significantly higher risk of death, especially if they already have conditions like diabetes or heart disease.
Many of these fractures could be prevented with better screening and early intervention. The problem is, osteoporosis is often underdiagnosed. By the time someone falls and breaks a hip, the damage is already done.
That's why fall prevention needs to be a top priority in senior living communities. It's not just about installing grab bars and using non-slip flooring. It's about proactive bone health management. That means regular screenings for osteoporosis, making sure residents are getting enough calcium and vitamin D, and even considering medications that can strengthen bones.
Exercise plays a big role too. Weight bearing activities, even something as simple as walking or light resistance training, can help maintain bone density. But how many senior living communities are actively promoting strength training for residents?
Not enough. And that's the challenge. The study reinforces that osteoporosis isn't just an inevitable part of aging. It's something that can be managed and even prevented with the right strategies. Preventing one hip fracture could mean preventing a serious decline in health, hospitalizations, or even loss of independence for a resident. The key takeaway here is that bone health needs to be a routine part of care planning, not just something addressed after a fall.
Definitely. Okay, let's talk about a new study in the Alzheimer's and Dementia Journal that's exploring a potential breakthrough in dementia screening. Scientists have identified subtle changes in speech that may predict cognitive decline years before traditional diagnostic methods. If validated, these findings could offer a non-invasive early warning system for identifying individuals at risk.
This is really interesting. The Alzheimer's and Dementia Journal reported that researchers found that subtle changes in speech, things like hesitations, word repetitions, and slight differences in sentence structure, might be early indicators of cognitive decline. And we're talking years before traditional tests would catch it.
That's huge because right now, most dementia diagnoses happen after noticeable memory issues appear. By that point, the disease has often progressed significantly. If speech analysis could flag risks earlier, it would give residents, families, and caregivers a chance to intervene sooner.
And the best part? It's a non-invasive approach. No lab tests, no expensive imaging, just analyzing the way someone speaks. The researchers used artificial intelligence to evaluate speech patterns and found clear differences between people who later developed dementia and those who didn't.
This could be a major breakthrough for senior living communities. Routine conversations with residents could provide valuable data about cognitive health, allowing for earlier interventions like lifestyle changes, cognitive therapies, and care planning.
Of course, it's still early research and more studies are needed to confirm just how accurate this method is. But if it holds up, it could change how we think about dementia screening.
Let's move on to another key factor in cognitive health: social engagement. A new study reinforces just how important staying connected is when it comes to reducing dementia risk.
Yeah, this study by the Journal of the American Geriatric Society found that older adults who regularly engage in social activities, whether it's group conversations, community events, or even casual daily interactions, have a significantly lower risk of developing dementia. The researchers believe that staying socially active helps keep the brain engaged, strengthening cognitive function over time.
It makes sense. When you think about it, social interactions require memory, problem solving, and emotional processing, all things that help maintain brain health. It's like a mental workout that happens naturally through conversation and engagement.
And this is where senior living communities can make a real difference. Encouraging residents to participate in group activities, fostering friendships, and even incorporating structured programs that promote conversation could have long-term benefits. It's not just about entertainment, it's about supporting cognitive resilience.
The study also highlighted that loneliness and isolation can have the opposite effect, increasing the risk of cognitive decline. That's why it's so important to watch for residents who may be withdrawing from social activities and find ways to bring them back into the fold.
For communities looking for creative ways to engage residents, HealthCap offers a Dementia Activities Toolkit with ideas for group activities designed to promote social interaction and cognitive stimulation. You can find it on our Resource and Education Center.
This is another reminder that dementia prevention isn't just about medical interventions. Lifestyle factors like social connections play a huge role in brain health. Let's talk about a growing trend in healthcare, private equity investment, and how it's affecting patient care. A new MedPage Today investigative report examines the increasing role of private equity in healthcare, revealing concerns about profit-driven decision-making and its potential impact on residents, caregivers, and providers.
Over the last decade, private equity firms have invested heavily in hospitals, senior living communities, and other healthcare sectors, often looking to maximize returns in a short time frame. The issue? Critics argue that this financial strategy prioritizes cost-cutting and revenue generation over patient care, leading to reduced staffing, lower quality services, and even facility closures.
Yeah, the report highlights cases where private equity-backed healthcare organizations made drastic operational changes, cutting staff, reducing resources, or restructuring services, resulting in negative outcomes for both patients and employees. In some cases, rapid turnover of ownership has left facilities struggling to maintain stability, with residents and families caught in the middle.
Right, but defenders of private equity investment argue that these firms bring much-needed capital to struggling healthcare organizations, helping to improve efficiency and expand services. However, the lack of transparency and short-term profit goals raise concerns about whether these investments truly benefit residents and the long-term sustainability of care.
For senior living providers, understanding the influence of private equity is crucial. Whether or not a community is directly impacted, the larger trend of financial restructuring in healthcare could lead to changes in regulatory policies, staffing expectations, and operational pressures across the industry.
That's a wrap on this week's biggest stories. From the financial pressures facing senior living communities to new insights on osteoporosis and dementia prevention, there's no shortage of challenges and opportunities to improve care. Staying ahead of these trends is key to providing the best possible support for residents, caregivers, and communities.
If you want to dive deeper into any of these topics, You can read more in Angie's weekly roundup on Angie's blog. Check it out at healthcapusa.com/Angie's-blog for links to these stories and more insights for senior living leaders.
Thanks for joining us. We'll be back next week with more of the latest news impacting senior living.